Here he comes. Whew.
So hello, everyone. Welcome to Ethics for Lunch for February. And our topic today is moral suffering, challenges, and opportunities. None of our panelists have anything to disclose. And we invite you to be engaged in our usual conversation here. This is meant to be a conversation for our community to engage in topics that are important to us and that actually raise some important ethical dimensions. To verify your attendance today, we invite you to text to the number there, 443-541-5052, and then put in the code 38115. And that way you'll get credit for being with us today. So we thought it would be important for us to take a pause together and to talk a little bit about what we've carried during this pandemic and the sort of moral residue that has gone along with the many challenges that have come up during this period of time. And we have a great panel today, and I'm going to ask them each to just introduce themselves really briefly. Carol, would you like to start?
Hi, I'm Carol Long. I'm a pediatric nurse practitioner in the newborn nursery and a member of the ethics committee.
And Matt?
Hi, I'm Matt Norvell. Some feedback. I am a chaplain. I work specifically in the Department of Pediatrics, and I am the clinical manager for our department across the hospital here. And I am also a member of the ethics committee.
And Shannon?
Hello, my name is Shannon Barnett. I am a child psychiatrist and also a member of the ethics committee.
So we wanted to start today with some words of our colleagues. And what I'm going to share with you is a very short clip that is reflective of some interviews that were done of nurses early in the pandemic. And to use this as a way to sort of ground our thinking about how the pandemic has shown up for us and what we've carried in the period of time during this pandemic. And so just to take a moment, can everybody see my screen? Okay.
We just kept taking 10 steps back. Eventually, finally, someone would finally say, there is nothing else that we can do.
We currently are experiencing extreme staffing shortages. And that's because people are leaving the field in droves.
There were definitely those who were on board and saying, hey, this might not be what we signed up for, but we're here and we're going to try. And then there were those who said, this is too much. This is not what I signed up for. And in either picture, you can't blame the human.
It was very apparent that our healthcare system was not set up to actually take care of everybody. And to work in a system as somebody who feels like their calling is to be a healer, that was deeply disappointing. There's an element of anger. Why does this have to happen to all these people?
Still like we're living in a warlike system. Like we are still shoving people into closets because they so happen to have oxygen adapters. We are still putting two people where one person should be. Sometimes there's just not time or space, and you take what you can And if you're really having a rough time, you can go and talk to whoever's in charge that day, and they will absolutely tap you out and make sure somebody's there for you.
I don't know how many other people have talked about all the death. It's not just that they died, it's how they died.
I was just seeing the toll that our system was taking on our caregivers, on our nurses, our techs, doctors, everybody. We were just all pushed to our limits, and that really took a toll on my mental health.
I can tell you most of my colleagues, that is part of their signature, is giving the most dynamite care. So when you don't feel like you could give all of your time and care to somebody, it eats you alive.
You don't feel resilient. You feel beat down. A lot of people have had almost like an identity crisis of like, I can't do this. What am I going to do next?
Every morning, the charge nurse would just thank us for coming back. And that was so meaningful to me, acknowledging that, like, yeah, this is terrible, and regular sane people would not come back to this. This is not an okay place to spend your time, but you're coming back because you care, and thank you so much. That daily affirmation for me was such a big deal.
So we wanted to shine a light on the reality and the full spectrum of what people have experienced. And part of what people have experienced is exhaustion, physically, emotionally, and I would say morally. And so today what we wanted to do is to talk a bit about the dimension of moral suffering and to see if we can give voice to it and to offer some ways of thinking about it, but also, as you saw in this clip, both the challenges and the opportunities that suffering has brought us, and how we can potentially use this opportunity to re-examine our own values, but also to forge a path forward for the kind of environment we want to create for all of us to practice in the way that reflects what really does matter to us. So to start that, I want to start with a little bit of content and also to take a moment as we begin to really remember why we're here and to remember why our service matters, why we've chosen this work, and also to remember the contributions that we've all made during this time. There's been a lot of challenge, but there's been a lot of incredible service as well. So just to remember that orientation. Clearly, during this pandemic, everything has changed in ways that we couldn't have anticipated. And along with it have been a whole host of ethical challenges. And when you think about that, there has been a lot of moral adversity. And that moral adversity has shown up when either the internal or external circumstances produce some kind of morally objectionable or troublesome or unfortunate outcome. The ultimate consequence is that it imperils or undermines our integrity in some way or another. So as we begin this conversation with our panel, I would like to invite you to share in the chat, if you feel comfortable, the kinds of moral adversity that you've faced during this pandemic. And we're going to be asking our panel here to reflect on what they've seen, but we'd love to hear from you as well. If you would like to share in the chat, what have you carried? What are the things that have stayed with you during this pandemic? So I'm gonna turn to Carol, and just ask you to just reflect for a moment. What have you noticed that people have really struggled with during the pandemic?
I think initially or early on, particularly before the vaccines, there was a constant fear of getting COVID, and would you spread it at work? Would you give it to your patients, your colleagues? And, you know, you were kind of walking on eggshells. Even after the vaccines came, people heard that, you know, because it was a respiratory virus, it was really kind of hard to understand. Many people felt like their workload was going way up, and they're to echo what was said earlier in the video, their standards were being compromised. Biocontainment caused isolation, and I think suffering for both the patient and the staff if you were in the bio rooms all day. And eventually there were feelings of some betrayal as fellow staff members felt like they just had to leave. And people came in, while it was helpful to have travel nurses, the feeling of your group was disintegrating. And, you know, from the perspective from adding into this, just when there were bed shortages in maternal child health, sometimes you had to separate mothers and babies to accommodate a greater good. And that caused a lot of suffering for many people.
Thank you, Carol. Matt, what are your reflections about what people carried and the residue?
When I think about the moral adversity that people have been experiencing, that is on top of the regular moral adversity that we had 3 years ago in the world of healthcare, the theme that comes back to me is this this lack of being able to be in relationship the same way. I mean, I really resonate with what Carol said, the word isolation. People have just not been able to relate to their colleagues in the same way. They've not been able to relate to or care for their patients in the same way. They can't relate to or care for their family members in the same way. Leaders can't lead in the same way. Like it goes every direction. And that has, often relationships are the things that help to sustain folks through the hardness of healthcare. And people know it's a hard job when they show up, but they know that they have colleagues that they can sit with and talk with and relax with and maybe go out for a drink with after work. And as that has been interrupted, I think that has added to and amplified the moral adversity that people have faced.
A really good point, Matt. Shannon, is there anything you want to add? What have you observed?
I want to add, I think that there's been people straddling, and maybe because I'm a child psychiatrist, straddling, I want to do what's best for the public health with the pandemic, but also seeing the adverse effects. So, shutting down schools, I saw, there's pluses to it, but also significant negative mental health aspects. And just, I think that there's been lots of places in medicine where maybe what's best to try and contain COVID has other negative side effects, which then I think leads to a lot of kind of inner conflict, but also maybe where I think we need to land is different than where my colleagues need to land. And so I think that's made it very hard, because it's almost like sometimes there's two competing demands. And when we want to be doing what's best for the health of our patients, it's been very difficult.
Yeah, thank you for that. It's a really, really good point, that in response to this moral adversity, we experience various forms of what we call moral suffering. And that is really thought about as the anguish in response to some kind of moral harm or failure or unrelieved moral stress. And what we know about moral suffering is it can be triggered by witnessing or participating in or directly causing situations that we believe cause harm in some way, and that really erode our sense of integrity as a person. And so in our work that we've been doing now for a number of years, we began to think about this continuum of moral suffering that begins first with the experience of moral adversity that we perceive as threatening our integrity in some way. And initially that might be experienced as a kind of moral stress, that signal alerts us that important values are at stake and that there are important trade-offs that need to be considered. And that motivates us to explore and examine the issue. And it's possible at that stage that that moral stress could be relieved by doing what we believe is the right thing. In other situations, we experience moral distress, where we see a situation where moral action is required. We recognize that we have responsibility, we reason about it, we decide this is what I should do, but because of internal or external constraints, we actually can't do what we think is right. Moral distress has been the most highly researched type of moral suffering. But what we have learned in the pandemic is that moral suffering can also include more corrosive types of moral suffering, including moral injury. Moral injury is a term that really began in the military and has been researched most extensively there, but has been applied now in the context of healthcare. And it's often defined as a kind of profound psychological distress that results from actions or lack of those actions that violate our moral or ethical code. And this can be a personal experience or it can be collective. And what I think we've seen in the pandemic is there's a kind of collective moral injury that clinicians are experiencing. It typically occurs in high stakes situations where in the moment, people may not even recognize what is happening. And it may not be recognized until much later, retrospectively looking back on the situation. So if you think about the pandemic, many people were in full court press for long periods of time. And it's only now, or in periods episodically during this last 2 years, where we've paused enough to really realize what has happened. And this type of moral suffering occurs in response to severe, unmitigated transgressions or betrayals. And what's different about moral injury, as opposed to moral stress and moral distress, is that the consequence of it is a dismantling of our moral identity, a sense of who we fundamentally are, and often challenges our sense of worthiness as a person. So in comparison to the other types, this is a much more corrosive sense of, as you heard one of the nurses refer to in the clip, an identity crisis. I don't know who I am anymore. And I have certainly heard nurses and others say, I'm having a hard time making sense of this experience. And I don't know, am I still a good nurse? And so those kinds of questions are what really we want to focus on is this whole continuum. And just to give us a little bit of data of what we've learned during the pandemic about both of these, we know that people have experienced both moral distress and moral injury. And the kinds of things that have caused moral distress are not unfamiliar to us. They were present before: scarce resources, working with colleagues who were not skilled enough, lack of resources like PPE. But what was a little bit different was the risk, as Carol pointed out, of transmission to family, or caring for patients when their families were not present. What we found in a study that we did with our Canadian colleagues is that healthcare workers who were caring for patients with COVID, they had more severe moral distress, anxiety, and depression, and a higher proportion screened positive for mental health disorder compared to people who were not caring for patients with COVID. So there's something about this whole phenomena that has intensified the consequences. In addition, we've got research on moral injury, and we actually did some research during the pandemic, the prevalence ranging anywhere from about 20% to, in our sample, 38% among nurses who had clinically significant symptoms of moral injury. We know that moral injury has an increased risk of PTSD and depression. It's highly correlated with burnout and medical errors and suicidal thoughts. And so these consequences are really important. What we also found in our own research is that we created a series of ethical concerns, and the higher scores on any of the items were correlated and associated with higher scores on moral injury. So things like experiencing negative consequences at work if safety concerns were raised, working with limited resources, implementing the decisions of others when it threatened our own values, losing the ability to advocate for their patients' needs because of resource constraints, having to make decisions to limit or forgo interventions for patients without the usual involvement of them or their surrogates, and concerns about being infected while performing our professional duties. So this data gives us a little bit of a clue about the kind of circumstances that may produce these kinds of symptoms. So I wonder if you feel invited to share a little bit of your own experience about what your own consequences have been during this pandemic to you physically, emotionally, mentally, spiritually, and importantly, from a moral perspective. And I'm going to ask our panelists to reflect on what have you noticed in terms of the consequences? What kinds of behaviors, what kinds of consequences have you noticed as you've been interacting with your colleagues? And I'm going to start with you, Matt.
So I was just reading this comment in the chat about, it starts with political name calling from many sides, and it's referencing, I believe if I'm looking at this, reading this correctly, it's referencing physicians going out into rural communities, attempting to help raise awareness and provide vaccinations. And we think about somebody who gets put in that position to trying to do good, right? That's why everybody has shown up to work in healthcare. They're trying to be helpful. And then to have that effort diminished, and possibly even then for a professional to be insulted as they're attempting to carry out the good work that they showed up to do. I just think about the impact that has on somebody is amazing. And when I think about how it impacts somebody's sort of existential worldview, self-view, personal spiritual worldview, my worry is that it can undermine, to use your word, Cinda, erode. It can erode somebody's grasp on how the world ought to work.
Yeah.
And
really good point.
And we show up thinking like this is, if we put in the good effort that other people are going to listen, or the good things will happen. And when that doesn't happen, it calls everything into question, which leaves some people without any firm ground to stand on.
Absolutely. Carol? Shannon, would you like to? Carol, you want to say, what have you noticed? Consequences?
Well, I guess the positive consequences would be learning how to relate through technology, going, screen time, all of this. But I think ultimately, for many people, there's been a sense of loneliness because in painful situations, people come together, they share food, conversation, and the nature of a respiratory pandemic has altered that way of being. And so people, again, have been isolated, but we couldn't have a big pot of food. You had to wrap everything up individually. And for people who coped by being with their group with a big hug, that was not possible. And I noticed that there was a tendency for people to not really bring their best selves to situations and to not assign best intent for some of their colleagues' actions. And there was just more triggering that would sometimes go on, and people found it difficult to be relational in the way that they had been before. And I asked someone the other day, in the office, what do you think this led to? And for some who stuck around said you eventually you learn to become somewhat indifferent to protect yourself. And then ultimately that old word we know, burnout, can ensue because you don't see any hope or end in sight, and you miss coming together collectively like you used to when during difficult times.
Yeah, thank you, Carol. A couple of comments in the chat. Loss of friends due to different beliefs about the pandemic, loss of trust. And I want to come back to that, Edward, who wrote so beautifully about failed trust and failed trustworthiness is moral suffering for providers in public health and of whole communities who once trusted and who need to trust public health. Really, really important. Karen says, I struggle with passing judgment on those who are not vaccinated because they refuse to be vaccinated. That goes against my own moral code. And Lori says, morally, that edge where trying to protect patients and families and colleagues and people in our lives is not just positive, it's just neutral. It has done harm. We've passed the point about fear of retribution on the last slide is pretty scary. So, I think these things are important to say out loud for ourselves, that there's a way in which we've, in some ways, wanted not to look at this part of the reality. And I wonder, Shannon, do you want to talk a little bit about the relationship between moral injury and PTSD? You want to say a little bit about that?
Sure. I think PTSD has been kind of around a long time in the field of psychiatry. We think about it as being triggered by an event, but moral injury is also triggered by an event. Both include re-experiencing and remembering the event, and they're both associated with negative emotions. So there's some significant similarities, but some differences. In moral injury, guilt and shame is kind of the core feature. You can have PTSD without having guilt or shame, although you sometimes have it. But moral injury, that's kind of the core feature. That's perception-based, so someone perpetrated something, an event outside of my own values and emotion. And then I think the last thing is the emotions often develop after the event. So in PTSD, you're often, during the trauma, you have the fear and you experience that fear, but moral injury, you often kind of get that guilt and shame afterwards. Other differences, PTSD, hyperarousal is necessary, which is not always seen in moral injury. And it's more fear-based, so the fear of risk of death. But often there's both, and people can get some of both. So I think it's important. A lot of people were afraid for their lives or afraid for their loved ones' lives, and they were having a moral injury as we've kind of gone through the pandemic. So it is important to know that they can co-occur. And we also, there has been some studies that show that in people where they have both, this re-experiencing of guilt and self-blame actually does increase the risk of suicidal thoughts, even when we adjust for post-traumatic stress disorder, for depression, and for substance abuse, which are all associated with increased risk of suicidal. So adding moral injury has its own kind of additional risks. So I think the conclusion of a lot of this is it's something that's real, it's slightly different than PTSD, and it adds its own layer of kind of risk. And I think it's also important just to think about it, that it's not a minor problem that we should be brushing off under the rug. It's something that really has a huge mental health impact.
So thank you, Shannon. And, I think we have certainly heard of many examples of the consequences, the mental health consequences to clinicians during this pandemic. And part of, being a whole person is acknowledging all the parts of us that need attention, and that this pandemic has exceeded everyone's capacities. And it's not because people are weak or they're not resilient. That word has been weaponized to suggest that people are somehow failing, which in fact, I would propose that every single one of you on this Zoom call right now are resilient, and you have demonstrated that resilience over and over and over again. The reality is that everyone does have limits, and this pandemic has actually challenged us in situations where no one could meet them in a way that was whole and healthy, because the demands were so great at different times. So one of the things that it feels really important to me is that no one walk away with the feeling that if I am not okay, that that is a signal of weakness or deficiency, because it certainly is not. And part of being in integrity is asking for help as an act of integrity and not a failure. So to just invite us to be kind toward our limitations and compassionate toward them, and to think for a moment together about, so what do we do with this? How do we move forward, acknowledging that this is true? It has had serious consequences for many people. And yet there are ways in which we can use this experience to recognize the strength within ourselves and our teams and our organizations, but also to create a path for moving forward. So I wonder if who would like to start about what you think might be one of the ways that we could move forward? Carol, you want to start? What's one thing you think we might be able to take from this experience as a hopeful path forward?
Well, I think we've learned to live more in the moment, instead of trying to think about the past or the future, and to appreciate each day that we have with our colleagues. Any kind gesture someone does for us, any kind word that they have. I think to appreciate being with our patients. Things have gotten a little bit better, and really just appreciate the simple things. And when you're not at work, to try to be out in nature and watch the birds, because we know they have not been affected by all of this. And that's for me something that helps. But really to try to live just more in the moment and to be grateful for those around me.
Thank you, Carol. Matt, what's our way forward?
I just was, as you were commenting, Cindy, I was thinking about sort of the insidious nature of the moral suffering, is that it affects everything in a person. And when I think about like how it affects someone's own belief system, a lot of people end up feeling like that extra level of failure because they've lost a trust in how they think God works or how they think the universe works. And so then like we add that, like, so my belief system was really helpful to me and now I've lost that. And so finding the ways to not distance ourselves, but it's easy for me to wag my finger here and say, hey, don't isolate yourself. Like that's never worked for anybody. But it does give us an opportunity to really sort of double down and investigate why we believe what we believe. A lot of us show up to these situations with sort of whatever spiritual framework that we showed up with, and maybe it had not been all that examined before. And now we've had an opportunity to really pick it apart and examine it. And I think that is an opportunity for a lot of us, that as we, I hate to say get to another side, but as we continue on through this in a new way and to a new place, I believe that a lot of people's belief systems, they're not just, people didn't just shuttle everything, they're still holding on to something, but that it's going to be a stronger belief system, something that people are more committed to and have a better real grasp on an interaction with as they move forward.
Thank you, Matt. Shannon, what's our way forward?
One of the things I think has been really wonderful is that we now as a health system talk about our own mental health as providers. And in a way, I think we've never done before as a health system. It's been more normalized to take care of your own mental health. It's to take mindfulness breaks, to have carved out time to actually talk about our mental health. And so I'm really hopeful that as we move forward, that those things stay with us as a profession so that we can continue, because it has always been hard to be in healthcare. And there has always been plenty of times to have kind of moral injury and moral distress that we maybe have held on our own. And I think we've learned to talk about it more because everyone's going through it at the same time. So I'm hoping that we can keep those things in place moving forward.
Yeah, my own journey with moral suffering took a little bit of a shift about 5 or 6 years ago, focusing on the cultivation of moral resilience, the ability to restore and preserve integrity in response to moral adversity. And we ended up doing some research during the pandemic, and we thought theoretically that moral resilience, which includes really a robust grounding in our personal and relational integrity and our ability to self-regulate and be buoyant and have capacity to deal with ethical challenges and also to be good stewards of our own personal resources. What we found is in a study that we did looking at the relationship of moral distress and moral resilience in a Canadian sample, was that increased levels of moral resilience were associated with lower levels of moral distress and mental health outcomes like anxiety and depression. We also found that increased scores on moral resilience were associated with lower levels of burnout and turnover. We saw a similar pattern in relationship to moral injury and moral resilience as well. So higher scores on moral resilience were associated with lower scores on moral injury. And so what we're beginning to realize is that these capacities can be a kind of protective resource for us. And that doesn't suggest in any way that cultivating these capacities within ourselves denies the very real systemic contributions to the circumstances that create our distress. But rather, it's a kind of investment in our own well-being that that I can restore my sense of agency instead of feeling like I'm powerless or I'm a victim, to being able to choose how I want to be and how I want to respond in a particular situation where values are in conflict. So, there are some ways that I think we can begin, at the individual level, but I wonder if we could talk a little bit about the system level and how it is, how do we begin to design the system so that the things that are modifiable in our work can actually be modified to reduce the likelihood that we're going to experience these circumstances that cause this kind of moral suffering. And I'm wondering, what thoughts you all have, and I would invite our audience to also contribute. What do you think would be a fruitful path forward as we try to think about this both at the individual level and at the system level?
And send it right on cue. David had a question right on that theme. It's in the chat.
Asking for a friend, what should we be expecting asking of our C-suites and other leaders to address the conditions that create our distress? Of course. David says, I resent hearing how much it's costing to use agency nurses to replace the staff who have left. Well, I'm going to say something that I've said many times. The most important ethical document in an organization is the budget. So if we want to be serious about demonstrating our commitment to innovation and change, I think the budget is probably the place to start. How are we going to demonstrate that we will invest in, I think Shannon mentioned having space for people to have a conversation like this. How do we staff so that that's possible? What other solutions do you have?
Since we're quoting ourselves, I often say the best government is local. And so I think that connected to what Shannon was talking about is making sure that those of us who have leadership capacities to make sure that the people that we're leading are cared for, and that people that we have any responsibility for or responsibility with have the opportunity to stop and talk about conversations. We can continue to poke in whichever direction to say that there needs to be more budget for X, but until we can get some good practice evidence about what X is that works well, then we're just throwing money at in a big hole. And so we need to find the right ways that we know, whether it's on a very individual, local unit or department level or institution level, we've got to try some stuff and figure out what is really useful and how we can continue, like you said, how we can continue to develop and strengthen those capacities that we know are going to keep us morally healthy.
I would just add to what you said, Matt, we need to ask the people we're trying to serve what they need, because they really are the ones who can tell us, I think, what is needed and what would make, the workday more sane, or what resources, what kind of, environment would make it possible for them to leave work every day and feel I have served in the best way that I can. Carol, you have thoughts? Shannon?
I always like the adage, information is power. And so I think communication is really important from the leadership, the people on a regular basis, to know where things stand and maybe have just some information about expectations. The protocols around when to call the hotline, and it was kind of a little bit eerie there in January, and each day you'd come to work just wondering what was next. I really like your idea of asking everyone, having a survey of what would be helpful for people moving forward. The RISE team, I think, has been very effective. But what other things would, one of the things that I've heard from people who work at night is they wish they had a place to gather at night to get food and coffee, and that there isn't anything for them right now. Well, just to get away and take a break. So I wonder if, the organization could just create a space. We used to have a place called the Carter Cafe in the old days. I think people who work the night shift would like to have that kind of a space to gather. But surveying the staff, I think there's no shortage of ideas. Plenty of ideas come when you're isolated. You have more time to think. So maybe a nice survey and ask people what they need. I like that idea.
Shannon, what's your thought?
I wanted to add also, one thing I've heard a lot of is not just how to take care of ourselves, but our families. It's been, I know as a parent of young kids trying to work from home and having to kind of juggle my kids, even now, the threat of your child has to stay home. Like now that my children have to stay home every time they have a cold. And I've heard that a lot of people have just said, really, we need a lot more of help on how do I manage that, taking care of both my family and also my professional duties. And so just being able to think outside of the box of how to be more supportive of everybody as they kind of are juggling really two, 3 full-time jobs.
Shannon, it makes me think about, integrity is not just our professional integrity. It is, how can I be a whole person in the context of being a professional and being a parent and a spouse and a partner, or whatever other responsibilities we have. All of those dimensions, I think, are really important for us to consider, and how do we take care of our teams? I'm wondering if you have any thoughts on that as well. We did during the pandemic, twice a month, we were doing moral resilience rounds. We're still continuing them once a month, but these gatherings of places where people could bring whatever it was they were carrying, and to feel like that it can be explored and borne witness to, is really important. Because earlier, I believe one of our participants Edward talked about trust. And I think that we need places where we can be transparent with one another and share what's true, but also to really support each other. So I don't know if Matt or anybody else has any thoughts about how teams might be able to do.
I know that I've had the opportunity to be a part of some conversations with teams to be able, as you just said, Cindy, to be able to create a space where people can bear witness to what each other is going through. And that can sometimes be a real frustrating session, because people don't come out of it with a solution about how to fix it and how to make it better. And a lot of people really appreciate being able to hear, just as Shannon just mentioned, to hear other parents talking about the frustrations of the whole school process right now. And to know that I'm not in this by myself, and I'm not the only one who's really trying to hide the fact that my kids got sniffles today, and so that they'll go to school. But giving people the opportunity to say those things out loud with each other really helps. I was actually in a session the other day where one person started to talk about the challenge that they had. Like, they had a very clinical job, and so there's no work from home from them. And they were married to someone who was working from home, and was talking about the frustrations of going home to someone who's been cooped up all day, right? And then across the room, one of that person's colleagues says, "I've got the same issue. I've got a spouse that works from home, and it's like going home to a puppy who's been locked up all day," right? And so to be able to have those two people didn't know that about each other, and yet they're colleagues, and they work together. And being able just to kind of create that opportunity for the relationship even in the midst of no good, big, broad solutions now.
Yeah. Matt, it makes me think about relational integrity. All of our integrity is intertwined with each other's, and we can know what's right for us, but we're always negotiating in relationship. And so Carol pointed out early on about, under stress, we probably are not going to communicate in the best way. We may not be able to empathize. We lose our sense of connection with ourselves and each other. And we feel numb. We might be just going through the motions and feeling really shut down. Whereas other people go into, mania almost of just, hyper sympathetic arousal where, it's on hyper alert all the time. So both of those I think are normal responses to the kinds of things that we've experienced. And what we wanted to do today was to shine a light on how all of these different dimensions really are intertwined, and we are suffering physically, we are suffering psychologically, but we are also suffering morally about how do we reconcile many of these conflicts of values in a way that allows us to feel whole in the end. And what are the things that we can do to try to support and restore our wholeness when it's been threatened or violated? And how do we as a community create spaces where we can name what's true? And today was really about creating a space to begin to name what's true and to offer not the solution, but to invite us to think together about how we want to create the support systems, the ways that we can choose to respond ourselves, but also what is needed within our system so that we have spaces where these kinds of challenges can be addressed. Many of you have reached out to us during the pandemic and our ethics committee and consultation service to try think through some of those hard questions. We don't have the answers, but we are here to try to help with thinking through the hard choices that sometimes are necessary. And to know that that's a resource that is available to you. And also the RISE team, as Carol mentioned, and the chaplains, as well as our mental health professionals are available to you if you feel that you need some additional support. And we look forward to having more conversations together. And I just want to end our time together today by saying thank you for showing up today, but thank you most importantly for showing up again and again and again during this pandemic. We see you, we appreciate you, and we thank you for what you have done. So thank you for joining us, and we look forward to our next conversation next month.